Good afternoon. Can you hear me okay? I've had a little bit of sinusitis, so I'm not going to have a big booming voice. Very quick about my background. My family name is Gandolfi, Italian, born in the US, raised in Venezuela, South America. So I'm a third culture kid. Back to the States, long story short, finished high school. I'm a Vietnam vet. So I went out to Vietnam. I was trained as a combat medic and eventually I went in the operating theater and I was a surgical first assistant in orthopedics. Finished my tour in Vietnam, back home to Hawaii, finished my pre-med studies, going off to medical school to be an orthopedic surgeon, had an aha moment, cliche as it is, said goodbye to orthopedics and hello to neuroscience. So I've been in the profession about 40 some odd years. My specialty is in neuroscience and research and practical applications. I look at anxiety, eating disorders, depression, wellness, et cetera, et cetera. Professor, lecturer over the years, many universities, bit of research down in Thailand with a couple of hospitals I'm at, have a practice here in Thailand and also in Hong Kong. So I'm 3 weeks every month here, 1 week in Thailand. And my approach is very interactive and very cognitive based to teach people about how to activate the doctor inside of who we are. So Voltaire, kind of hard to see the quote, but Voltaire basically was telling people back in his day, the job of a doctor is to activate the doctor inside of the patient that they're sitting with so that individual can be empowered and take agency to help with their health. So the talk was originally going to be for an hour. I'm a bit Italian. I have way too much to say and never enough time. So some of the slides I'm going to go very quick. Some of the slides I'll dive in a little bit deeper. Shock will have a copy of my slides. Feel free to read and kind of dive at your leisure, if you will. If you've got questions later on, always feel free to drop me a message free of charge. I'll definitely reply back to you, okay? Something free in Hong Kong. Next slide. So basically, Benjamin Franklin and this wonderful Dutch philosopher Desiderius, they both were saying the same thing at different times in different places of the planet. Benjamin Franklin was saying an ounce of prevention is worth more than a pound of the cure, if you will. And this lovely Dutch philosopher was saying prevention is better than the cure. So we spend very little money at the end of the day in prevention and healthcare. We spend much more money on treatment and, if you will, the cure than education and prevention. So we're trying to change that every single year with our GDP in healthcare in Hong Kong and other places. Next slide. So having said that, Thomas Edison, he even got into this. And he said the doctor of the future will give no medicine, but will interest his patients in the care of the human frame. Look at this place. As well as, if you will, in diet and in the cause and prevention of disease. So even back then, we were taking a look at prevention and education. Next. Yet, even though prevention is praised, cure is still preferred. It's amazing. With all the stuff that is out there on education with wellness, most people don't engage, and instead what they do is they wait for something to happen, then they go see a doctor. So hopefully today, you're going to get some insight on a couple things that will take your health to the next level. Next, please. So we have something that's going around now called Medicine 3.0, and basically it has about 5 key points. Client-centric, that means we no longer sit with the diagnosis. First, we sit with the person. Really get to know who that whole person is. Your personal life, your activities with food, exercise, your child history, et cetera, et cetera. We really get to know who you are other than just your diagnosis. Number 2, we're going to be dealing with evidence-based practices. So we're going to make sure things are coming out of research, if you will. Number 3, we're going to look at health span. And that is the new. Peter Attia, you guys heard of this guy, Attia? So he talks about health span and lifespan, and there's some very good stuff that's coming out of that as well. The 4th element we take a look at is the 4 pillars of health: nutrition, sleep, stress, and physical activity. So I'll give you a little bit of an insight on that today. And last but not least, epigenetics. Have any of you heard of the term? Epigenetics talks about how the environment impacts our genetics and allows our genetics to express themselves in a very different way. Scandinavia, for example, the classrooms, the ceilings are much higher. more windows for the kids to take a look outside. They see a lot of green and vegetation. Their math scores and their academic scores are quite high because of the environment they structured the kids to learn in. So a whole new area called epigenetics is exciting in healthcare, if you will. Next. So here's a very interesting point for you gentlemen and ladies to take into consideration. Wellness and well-being, they're not the same. They're different. End of the day, wellness is about an outcome. So once a year, twice a year, whenever you're seeing your physician for health care, we want to take a look at a healthcare score. That's called wellness. The wellness score arises because of your well-being behaviors. So well-being is about a behavior. Wellness is about an outcome. That's the new science. So when somebody is talking about wellness, it means the scorecard. If somebody's talking about well-being, it's talking about 4 pillars that you're activating in your body and your life every day. So they're different terms. And hopefully you guys can keep that in mind and just keep a track of that every single year in your life. Next. But what are the goals that we have in wellness? 3, in fact, not 1 or 2. Most of us think healthcare, wellness and well-being is about improvement, getting to good, then go to better. But also, wellness could be about sustainment, getting to good, keep the good. I'm 70 years old, 70. Okay? I want to keep my body the way it is now. So he tries to push me to get in the gym on a little bit more of a regular basis. He wants me to go from good to better. This old hippie, I like where I'm at. Thank you very much. So I'm all about sustainment. Okay? This guy over here is a little bit more about, if you will, going from good to better. Okay? And then there's prevention. That's another goal. So my patients who might have cardiovascular or diabetes or other issues going on with their health, I don't want them to go from good to bad. So you've got 3 goals in wellness and well-being: prevention, sustainment, and improvement. 3 ways to rock and roll. Okay? I hope you could see this quote, but it's real. What is happening to us at 50 started when we were 20. It just builds every year. And every year you might go in and see your doctor and get your labs and your physical and everything looks good, because basically it is. But something is still going on inside the body every year. And now we're trying to determine, really, how often should we go in and get a physical exam and see our doctors when we have a history of medical issues in the family or ourselves. Now a new model is being proposed, maybe twice a year. Who knows? There's going to be some very interesting stuff coming out because of this. Now, the Sicilian philosopher, not everyone from Sicily was a mafia guy. So Thomas Aquinas said this: beware of the person who reads but one book. Beware of that person. Next. My comment to everyone is, be aware of the person who scrolls. My WebMDers, University of YouTubers, Instagram College, and Dr. Googlers. Got to be careful with that. The information that's out there on the web, there's a group called the Pew Institute. Have you heard of them? PEW? They do some very good research on the internet. And they are saying anywhere between 55 to 75% on the internet is misinformation. So be careful. Be very, very careful. See a professional if you've got some ideas. Scroll, read, but go in and see a professional if you will. Thanks. So I put this out whenever I do a talk, and that is, it's called The Truth. So I've been doing this gig about 42 years, and every year I have to retool myself, because how we look at depression, or how we look at anxiety, or how I look at eating disorders, wherever I may be working with, every year we get new knowledge about the brain, mind, and body. So there's no such thing as absolute truth. In healthcare, we practice relative truth. It's always changing. So please make sure the doctor, the nurse, your therapist, your coach, whoever you're hanging out with, make sure those individuals are lifelong learners. Every now and then ask your doctor, when's the last time you went to a conference or read a book? They'll do that to you. I think that's a lovely question to ask your doctor. It's a good question. He always puts me on call with that one from time to time. Fair enough. So for example, relative truths of diagnosing. I'm a Vietnam vet. I left Vietnam with PTSD. Been there, done it. Got the t-shirt. And PTSD over the years used to be called soldier's heart disease, Civil War. Then it became shell shock. Then it was called battle fatigue. Then gross stress reaction. Then transitional situational disorder. Then eventually it became post-traumatic stress disorder. Then PTSD. And now it's called a trauma disorder. So diagnosis is constantly changing with different labels, different criteria. And that's why you want your doctors, your practitioners, be lifelong learners. Next. Oh, one of my favorites. I've been in the village 29 years now. I haven't met anyone yet who has a work-life balance in Hong Kong. If you know them, send them to me. They get free health care. It's free. There's no such thing as 50-50. Instead of work-life balance, it's work-life harmony. I work long hours, and my partner rarely sees me. But when she sees me, it's harmonious. So you got to make this work-life harmony become a reality. Oh, cholesterol, LDL, and all the stuff that's out there on the web now about this. At the end of the day, there are a lot of competing views and theories on cholesterol. And the one that I find real interesting, have any of you heard of this book called Fat Chance? It's not a bad book to read. But the author of the book is basically saying dietary fat may not be, at the end of the day, important for cardiovascular disease. Wow, that's a pretty bold statement. So we have a lot of relative truths out there on cholesterol. Make sure that when you're sitting down with your doctors, your therapists, your trainers, they have some very good insight about this particular competing view. Now, in my slides, I always have this little nice page called the takeaways. So it's a summary. So when you folks get a copy of the PDF, it has my high points in there. So if you don't have a lot of time to read, just go to the takeaway page. Very quick, take a look at it, put it back down, get back to work or whatever you're doing. So that'll help you folks learn a little bit better with this, okay? Good, next. So one of the things I'd like to teach you folks today is no matter who I'm working with, I want to teach my clients and my patients this thing called optimistic mindset. It's about willpower and way power. And so I'm going to go through this presentation a little fast. Usually it's a couple of hours, but I'm going to try. I think I got like 35, 40 minutes, right? Okay. So I'm going to give you the high points. Read over this. It's going to give you a good idea of how to enhance your wellness scorecard. Okay, next. So we have 4 pathways for well-being. 4. Nutritional well-being. We don't use the word diet. Nutritional. Number 2, physical activity. We don't use the word exercise. Physical activity. Number 3, sleep hygiene. I was trained at Harvard and I was also trained at University of Michigan in sleep disorders. They're 2 very good schools and they have different views on sleep hygiene. A lot of very interesting theories. Sidebar, 25% of happily married couples sleep in different bedrooms because they actually see that when they sleep apart from each other, the quality of their health care goes up. They might miss each other a little bit for the tickles and giggles, but more and more couples are sleeping in different bedrooms. Now be careful, don't go home and tell your partner that because that person may put you on the couch with a pillow and a blanket. Okay. And then the last one is stress management, very misunderstood. And I'll make sure you folks get a little bit of an update on that as well. So first, relative truths of nutrition, meal plans. Basically, we have about 8 that we have identified as very good evidence-based meal plans. And I'm sure some of you, if not all of you, have taken a look at this before. Competing theories, everyone has their preference, but you sit with the person. You don't sit with the diagnosis. And everyone's going to be different. So my diet plan is called Italian. Okay, so I love the Mediterranean diet, if you will, and I like having a lot of olive oil and a lot of greens and a lot of fatty fish in my diet for my age. But that's my choice because of who I am. Next. Supplements. Anybody in here taking supplements? Down at the bottom here, the National Institute of Health, NIH, since 2000 have spent $2.4 billion researching on supplements. $2.4 billion. And as of today, NIH has not blessed supplements yet. Many different viewpoints on that. Any in here take melatonin? Yep. Very misunderstood supplement. Melatonin is not a hypnotic. It helps the sleep stage get a little bit stronger. My humble 42 years experience with sleep disorders, guess when you should take your melatonin? 90 minutes before you go to bed. Most people take their melatonin right before they go to bed. Why 90 minutes? We have seen in the research, the gut brain, it takes about anywhere from 30 to 60 minutes to break down 50% of the melatonin. So you want it in your system a little bit quicker. A lot of interesting research out on supplements. CoQ10 is sexy, NAD is sexy, you know, the bees are out there, et cetera, et cetera. A lot of good stuff is out there on supplements. So work with a good doctor who can help you understand supplements that fit your lifestyle and your body. Physical activity. That has become a whole new interesting area of research, if you will. And that's why we don't call it exercise anymore. Physical activity can include walking. It could include stationary bike. It could include, if you will, doing a sport. It could include playing a game with your child in the backyard. It can even include, at the end of the day, a little bit of tickle and giggles with your partner. Sex is physical activity. Burns calories and enhances, if you will, oxytocin. So we have a lot of activities we can do in physical activity other than coming to HIIT. Clearly, number 1, 2, 3, 4, 5 on the list is please come to HIIT. That was not a commercial. But just reminding you folks, you're in a good space here and you got good people here who can help you with that. Next, please. Sidebar, there was a little bit of a rumor that that's Shock, but Shock wasn't available that day for the photo, so I think it was either James or somebody else who showed up and did that one for us, okay? But basically, with this, we're taking a look at intense physical activity, lactate. Lovely little, if you will, chemical that gets released when you folks are doing intense physical activity. And it does a lot of wonderful things for us, especially, if you will, it reduces a sense of hunger. It actually helps with weight loss. It actually helps with depression. It helps with people who have metabolic issues. It's a wonderful physical activity to take a look at. Do it under the guidance of your doctor and your physical trainer, and I promise you, you'll go from good to better. The second area that we're looking at is regular physical activity, 120, 150 minutes a week. And at the end of the day, it produces this protein, BDNF. Lovely little protein. And that protein does a lot for the human body. Yet, we still haven't figured out for people who can't do a lot of physical activity. Say I have patients that are, if you will, paraplegic, and they can't go to a gym and do the entire body. How many minutes a week should they be doing regular physical activity? We're still doing a lot of research on that area. But regular physical activity gives you a good chemical. Intense physical activity gives you a good chemical. Figure out what is your sweet spot with physical activity. So sleep. Here's a very interesting fact that a lot of people are not aware of. Do you know what the average time is for us to fall asleep? Anyone have an idea? Average time. 24 minutes. 24. And so my clients and patients I see in my sleep disorder clinic, they're coming in and they're panicking because they're not asleep after 15 minutes. Everybody is different. But normally we'll take a look at how you get into that cycle. And I tell everyone I work with, just relax, and when you're laying in bed, it's going to take about 20 to 24 minutes to finally get into that first stage of sleep. So be very patient and careful with yourself. Some of us take a little bit longer than others to fall asleep. Now we have 3 stages of sleep. If I had more time, I'd go in deeper details with it. The first is what we call relaxing. That first stage of sleep means you're disconnecting from work and you're connecting with home. This is when you can do devices. This is when you can do last call for alcohol and food. This is a time where you can watch movies, tickles and giggles with the wife, exercise, whatever. It's called relaxing. And we do that for about 20 to 30, 40 minutes, usually a good hour and a half before you go to bed. Second stage of sleep hygiene. This is the kicker. Resting. No devices. You got to say goodbye to the device. And easily for 30 minutes, stop the stimulation. Calm the brain down. Turn the lights down. Put on Barry White. Okay? I'm aging myself. I hope you know who Barry White is. Okay? Turn the lights down. Turn the air conditioning up and get your house ready to get into a resting stage. Slow yourself down. Now the third stage for sleep hygiene is sleeping. Now, right now, the Bible says, if we could use that term, 18 degrees in the bedroom. Not a lot of people like 18 degrees. We're still debating over what is the best position to sleep. That's a whole nother hour. Anybody here use weighted blankets? Interesting. I use it. My sleep score went up only by 2%, but I'll take that 2%. A lot of very interesting theories out there on pillows, et cetera, et cetera. So I could talk hours on this topic. So have a little bit of fun when you read this slide. I give you some tips of how to get your brain ready to get into bed. And when you go to bed, a very simple technique just to calm your brain down from an overstimulating. It's gonna look a little California woo-woo. I'm a hippie. But basically what you do, put your finger in the ear like this. And then basically what you do, you pull your ear out and up. Hold it for 5 seconds. Release. Do it again, out and up. And you do that for about 5-10 times. Guess what you're activating? Vagus nerve. Calm down your nervous system. You'll purr like a kitty cat. Okay? My panic attack patients, when they get on an airplane, Cathay's a client of mine, so I got that reputation. When they see somebody in the airplane doing the ear, you know Dr. Mark? Yeah. Okay, so do that technique, it'll help you a bit. Okay, go ahead. So we have a lot of sleep disorders that are out there. We just got to be very, very careful that, as I shared with you, our sweet spot with sleep is about 6 to 8 hours. And as this Irish proverb has said, a good laugh and a long sleep, they're the best cures for us. Okay, so sleep is very important for us as we get older. But what do you think is the most common roadblock for us when we want to practice our way power? It's a 5-letter word: stress. That gets in the way of everything that we want to do for our body for wellness and well-being. Many definitions out there on stress, many. And the name of my clinic is the Center for Stress Management. I wonder why. It's my bread and butter. I work with these disorders on a regular basis. Next. So there's a lot of definitions out there, and my definition is stress is both healthy and unhealthy. And so be very, very careful. If somebody says, you come see me and I'll get rid of your stress, run. You should not be with that person. Stress is important for your cardiovascular system so you can pump blood. Stress is important to get you out of bed and start moving in the day. There's healthy stress and there's unhealthy stress. So I hope this next slide is really going to resonate for you folks. There's just a lot of fairy tales out there about stress. You can't get rid of it. You need it. Number 2, very important, we have to learn how to manage our stress in very effective ways, whether it's eating or exercise or sleep, if you will. And fear is the most common feeling that gets us stressed, but also we can be stressed when we're happy. So a lot of times people think they're stressed because they're sad or angry. Some of us are stressed when we're happy. So be careful with that. A lot of facts and figures on stress that's just there for you folks to read, but Basically, we see it as a very dominant element with all patients who show up in emergency rooms, clinics, wellness centers, etc. Everyone's going to talk about their stress. And there's various types of stresses that the next time we have a longer workshop, I can help you folks deep dive into that. Next slide. Yeah, go ahead. So here's probably the slide of all my slides I'd like you folks to be aware of. It's this one. Sorry. Eustress, it's a Latin term that means healthy stress. This is the sweet spot. This is where we want to be. What happens in this town called Hong Kong is sometimes we get pushed over here into what we call performance stress. And either it's an acute stage or a chronic stage. And there's a lot of things that I take a look at when I'm working with somebody in either one of those silos of performance stress. Just to keep it simple today, if somebody's telling me they're fatigued, that word, that tells me that they still got gasoline in the tank. They could still move around and do things, but they're not quite at a full tank. So that's fatigue. But the other word is exhaustion. That means no gasoline in the tank. So there's a difference between fatigue and exhaustion. And I teach all my patients to differentiate. And you'd be surprised in this town, there's a lot of people that are in the state of exhaustion. No gas. And that leads to all sorts of complications in their life down the road. However, there's another kind of stress. Boredom stress. That's actually a phenomena. I work with people who are bored in their professions, their careers. And at the end of the day, the first type of boredom stress is stagnation. Little inspiration. Or if it's on the chronic side, it just means they're uninspired. They just clock in and they wait for 6 o'clock or 6:01 so they can go home. So you'd be surprised, even in Hong Kong, I have a lot of people who come and see me because of boredom stress. So touchy subject. Guess where I see boredom stress a lot more now than ever before? Marriage. Yes. And sometimes when couples come in and they think they have irreconcilable differences and they think that this marriage isn't working, I always hang out with boredom stress first and say, kids, when's the last time we had a little bit of a tickle and giggle and a wow? When's the last time we had a little bit more of a sparkle in your life? And so sometimes burnout stress is causing couples to think this isn't a good marriage, when in fact, at the end of the day, they just have boredom stress. So we got to get them inspired a little bit more. I could talk hours on that topic. Okay, next. So there's your takeaway again. So that's there for you folks. So the last part of my talk before I say goodbye is willpower. And there's a lot of material here, and I'm just going to hit the high points. Go ahead. Grit. A very interesting word that's being used more than ever before. I do a bit of research with University of Penn in the US. I work with people there who take a look at grit and resilience and so forth. And there's two types of grit. Resilience, that's about the now. And perseverance, that's about long term. So resilience is about getting the dopamine now. Perseverance is about wanting that dopamine at the end of the road. So have a little bit of fun with this slide and figure out which one is your go-to. Some of you are more about in the now type of grit. Some of you are a little bit more about the long term. At my age at 70, I'm more about the now. One day at a time, baby. When I was a younger lad, and I had six-pack abs, trust me, back in the day, okay? I think James has seen the picture, okay? I was more about that perseverance and that long-term goal, if you will, okay? Next, please. So there's a lot of neuroscience on grit, but the biggest thing of all on this slide I'd like you folks to remember is that failure, if you fail at something, even though you were doing resilience or perseverance, if you failed, certain chemicals get released in your body. So when I used to work with a big organization in the U.S. in healthcare management, and when I would hire doctors and nurses and others, if you will, I would always ask them, did you ever fail an exam? Did you ever fail? And if they told me yes, then I would want to know, did you go back and study more? And that tells me that they activated some sort of grit to pass that exam. I like that kind of person. I like people who have failed at things and go back and do it again and again. Next. On the other hand, motivation, grit tends to be a little bit more of a cognitive thing, whereas motivation tends to be a little bit more of an emotional thing. We see that in neuroscience. Two types of motivation, internal and external. Internal is your self-talk. I can do this. External motivation is, I'm letting him know, you got this. I'm his cheerleader. Know your type of motivation that gets you going. Some of us are more external motivators than we realize. I run a couple of drug rehab centers down in Thailand. My patients who show up there, I don't worry about their internal motivation. I make sure that whoever is working with that particular person is a good cheerleader, a good external motivator. Your doctors, your nurses, your trainers, Shock, James, everybody who's here at HIT, they've got to be very good cheerleaders, external motivators. If they're not, let me know and I'll be on them. Okay, next. So a lot of chemicals come out of motivation, a lot of chemicals. And so probably the most interesting chemical that comes out is called oxytocin. It's a bonding chemical. So especially when you have people around you that are motivating you, that oxytocin chemical goes up, blood pressure, hypertension goes down, cardiovascular and central nervous system gets improved a lot with motivation, especially when you have a cheerleader. There's your takeaway again. So, a couple more slides and I'm done. So as this says, let's inhale the good shit and let's exhale the bad shit. Okay? So I'm going to give you some good shit right now. Okay? Next. Oh, there you go. This is a little what I call hippie woo-woo for you. Real science. University of Osaka is doing research on this. The Japanese term is Shinren-yoku. Now, there's a couple ways to do it. I'm going to do the PG version. In Japan, we have various forests where you can go. You take your shoes and socks off, roll up your pants leg, or if your shorts, whatever, and you literally walk in this designated forest called a tree-hugging forest. Here it comes. I promise you, I haven't smoked any marijuana today, okay? And you're in that forest, you're kind of walking around, and you find a tree that you relate to. And guess what you do to the tree? You hug that baby. A couple of minutes. So if you can't find a tree, hug James, okay? James is our tree at HIT, okay? And when you do that hug, you're going to get some oxytocin chemicals. You're going to calm yourself down a little bit. They should have warned you. I like to make people laugh, okay? So that's one little technique to help you. Next. This is called the 3+3 brain hack. So that means if you've got stuff ruminating in your head and you can't sleep, or at work, you're all over the place. It's called the 3+3. Very simple. You're going to look at 3 different things for 10 seconds and say it out loud, like this. Black bag. Laptop computer. Light. Doesn't matter. Pick 3 things. Take a break. Then the second 3 you do, you literally have to tactilely touch something. 3 different things. Cell phone in my right hand. Cell phone in my left hand. Glasses in my hand. 3+3. Do that for about 2 or 3 minutes. I promise you it'll calm your brain down. It works like a benzodiazepine, like a very lovely Valium or Xanax. Give it a try. Next. And then this nice little tap and calm nervous system hack. A very, very lovely little technique. that you could do if you're going to go give a talk or you're getting ready to negotiate or mediate or do something that's a little bit stressful. You put your hand like this, and it just goes against your chest, and you go like this. 3 minutes. 3 minutes. And you're gently tapping your vagus nerve. Gently tap it. And after about 3 minutes, I promise you, you'll notice just a little bit of a drop in your pulse and your blood pressure. Second technique is this wonderful vagus nerve technique. And here's how you do it. Tap, 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 tap 10 times. 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 One more time. Activates that wonderful parasympathetic nervous system. It takes a while for your body to get used to it. It's not going to be like getting an injection right away, but it does work. But you have to practice and practice and practice. And usually my anxiety patients, I have them do it 3 times a day for about 5 minutes. Okay? So my final words of wisdom, I love what Michelangelo said. I'm still learning. And he said that when he was 81. So thank you all for coming today and learning today. Very proud of you. Thank you for that. Okay? And for me, I basically wake up every morning as a novice. I get comfortable with my uncomfortable, and then I try to go to bed at night as a sensei. Okay? Last. And that's it. So thank you all for coming. This is a good day to have a happy, hippie good day. So thank you very much for listening from this old hippie from Hawaii. Thank you very much.
I'd like you to imagine the following consultation, one that stands out to me, right? We've got a man in his 50s, works long hours, lots of takeout and quick snacks, no motivation to train, probably clothes are starting to feel a little bit tight, waistband is getting a little uncomfortable, probably Dr. Charles or Dr. Mark has told him off, it's time to, start exercising. But even if we were to start exercising, what do I do, right? How many sets and reps should I do? What exercises? Is my technique correct? I don't want to hurt myself. And then you've got so much noise out there, right? You've got the latest podcast telling you VO2 max, baby, that's where it's at. And you're like, dude, what is VO2 max? What's zone 2? Like, there's just so much, so much noise out there. And that's what I'm trying to highlight. There's confusion, there's noise. We want to hear the sound. And it's easy to get distracted, right? There's endless short-term goals. You've got be a Hyrox champ, run a marathon, lose the weight, build bigger biceps. On and on it goes. And I'm not saying any of those are bad, just so we're clear. The short-term goals are great. But what I am saying is I'd like us to have a long-term framework that tells us how to age gracefully, right? Something we can be distracted for now with our short-term goals, but long-term, where are we going? What are we doing, right? And especially for those who aren't motivated by building bigger biceps. Not everyone, which blasphemy to me, not everyone wants it. So introducing the centenarian decathlon. So coined by Peter Attia in his book Outlive, the concept is, what are the 10 activities you want to be able to do at age 100? Now, this is the framework we'll be using to define aging gracefully. Now, I want to make it clear, the 10 activities is specific to you, right? If you want to be skiing at age 100, if you want to be, running still, jogging, if you want to play with the kids, you want to be self-sufficient, it's your 10 activities. You have to make it, right, for yourself. And the most important thing is it's individual, it's client-centric, and that's what's going to make it motivating, right? My goal of still being able to squat at 90, 100 kilos is not going to be relevant for most of you. So it has to be relevant to you. So we're going to break this aging gracefully concept, we're going to have 3 frameworks. So number 1 is the centenarian decathlon. From there, let's talk age-related decline. Who's heard the term sarcopenia? Awesome. So what sarcopenia means, it's the loss of skeletal muscle mass and strength due to aging. Now you can average it out. The studies show that on average, after the age of 50, you're going to lose 1 to 2% muscle mass and strength due to aging. Now we can average that out to 10 to 15% per decade, which for those who are in finance or like a little bit of investing, it compounds, right? So it's getting bad and it's getting quickly bad. So it does matter. The big caveat though, the big saving grace is it does not decline like that if you are engaging in resistance training or cardiovascular training. Now, just for the purpose of this discussion, we'll make it really simple. Resistance training is any weights, so whether that's calisthenics, weights, kettlebell training. And cardiovascular training is anything that challenges your heart and cardiovascular system, your heart, your lungs, right? We'll just keep it simple. So this is part 2. We've got to have in the forefront of our head, there is a decline coming. It's not here, it might not be here yet, but there is one coming. And the last concept I want to talk about is a physical 401k. So for those who don't know, in the US, a 401k is your retirement fund, right? You make annual or monthly contributions and eventually you get to cash out at the end. We've got to have a physical version of a 401k. Every single training session you do, bit of fitness you build, cardiovascular fitness you build, all of that, we're making deposits to our 401k because eventually we're going to need to cash out from it. We need to have that physical retirement fund to withdraw from eventually. So now let's marry the 3 concepts together and reverse engineer the future you guys want. So first, you make the centenarian decathlon, right? The 10 activities that matter to you guys. From there, you factor in age-related decline into all the activities you care about. So if you still want to be able to hike, right? Let's say one of the examples we're going to use later is hike the peak in sub 1 hour 20, in less than 1 hour 20. Well, then you better have, factor in that you should be able to do it right now in 50 minutes, right? Because you want to factor in some decline coming in. And lastly, we've got to build that 401k. We've got to get to work. So if you have that fitness already, fantastic. That's motivating. That's empowering. You know you've got it. I've got to maintain it. And I've also got a framework. I've got to keep this because I still want to be able to do it at 100. And if you don't have it, well, it's a great motivator and a good framework to think, well, this is where I need to go because that age-related decline is going to eventually set in. So we gave one example, the hiking one. Let's go another one. So the ability to maintain overhead function. It's one of those that's never appreciated until you lose it. I'm sure Majid will be able to talk all about it. So Majid's a physio, right? If you're going to go traveling, you want to be independent. Well, we've got to be able to do the overhead compartment, right? Put our suitcase away. Let's assume, what's the limit? 12 kilos, 13 kilos? Somewhere there. So then you've got to be able to press 16, 17 to 18 kilos right now overhead. And you want to maintain that function for the years to come, right? So that would be our goal. And if I'm not a big skier myself, but let's say skiing is an important goal for you. You currently want to be able to do the blue slope at 100 years old, 90 years old, all ages apply. Well, you've got to be able to do the black slope now, right? Or you've got to maintain that blue slope skill right now. And the skiing one's an interesting one because it marries several concepts. You also need strength training, right, to be able to hold that squat position the whole time. Knees need to be resilient. You're also going to need some cardiovascular training because you're obviously going to be on the ski slope for a few hours, aren't you? So some of these goals are going to need a marrying of both strength training and cardiovascular training, right? We've got to reverse engineer backwards. Now, before I go on to the next topic, any questions? Perfect. Let's talk about my favorite topic, fat loss. Fat loss, fat loss. Now, let's first define what a healthy diet is. As Mark said earlier, there's many, many, many diets out there. But fundamentally, a healthy diet or a health-promoting diet is a diet that protects you from malnutrition or non-communicable diseases like diabetes, heart disease, and cancer, right? This is going to be our working definition. Now, when we're looking at constructing a healthy diet, at HIT, we use 5 factors that we use to help clients build their diets, right? The 5 we think that are the most important. Now, I've ranked them in the hierarchy of importance, but I do want to say that all are important. Don't come at me later saying number 5 is more important than number 1. They're all important. So, when we're looking at healthy fat loss, number 1 is going to be adherence to the plan. You can have the best nutrition plan. You've got a team of nutritionists, you've calculated every single vitamin, supplement, best food out there, organic, this, that, and the other. But if you can't stick to the plan, it's pretty pointless, right? You're not going to achieve anything. So it has to be sustainable. It has to be fun. It has to be enjoyable. You have to actually enjoy. So if there's foods from your culture or background that you love, you're going to have to find a way to incorporate it or modify it so that it still fits the plan. Number 2 is caloric intake. The amount of calories you eat every day signals to your body which way we're going. Are we going up? Are we gaining weight? Are we going to lose weight? We want to lose fat in this example, right? In our example of the 50-year-old man. Or do you want to maintain your weight? It doesn't matter what you do. The calories are crucial to ensure that you're losing weight. From there, we've got nutrient density. We want to maximize micronutrients and fiber. Now, if we want to have a healthy diet, we've got to be eating enough fiber. We've got to be eating enough micronutrients, right? This is important for brain function, heart function, everything works better. Now, luckily, we don't have to make it too complicated. As long as if you're eating some vegetables with every meal, you're getting enough fruits, you're going to be okay in that regard, right? Your micronutrient, check. Next, we've got macronutrients. So we're talking proteins, we're talking carbs, we're talking fats. So we can, let's say we created a nutrition plan that you can adhere to. The calories are good, you're losing weight, but it's a very carb-centric diet. You're going to find yourself, it's not very conducive to retaining muscle mass. You might find your strength training, you're not recovering well, skin, hair, nails, teeth, all of that needs protein. So there's a bit of a problem there. If you've got a really protein-heavy diet that's not got enough fat, you're going to run into other issues with digestion, hormones. So you need a good balance of everything, right? And then from there, hydration. Our bodies are made up of 60% water. There's not a single chemical process in our body that doesn't involve water. So hydration is pretty crucial, to say the least. So if you look at all these factors, you'll notice it's relatively vague. That's a good thing. You want it to be vague. Vague is good because then we can individualize it, right? We've got people from all different cultures and backgrounds. So if you've got a more Indian style of eating, right? We still can, hit the calories, ensure we're getting enough nutrients, right? We're eating some lentils, we're eating some veggies. That way we're getting our micronutrients and fiber. We can add, if you're a vegetarian, you can add some egg whites or perhaps some protein powder. Find a way to increase the protein content of your diet. All of these factors can be individualized to whatever your style of eating is. And it's absolutely crucial that we hit all 5 of these. And that's how we construct a healthy fat loss diet. And also, it's okay to be different. Whether you want to do intermittent fasting, you want to do 3 meals a day, 4 meals a day, that's the beauty of it. All are okay, assuming we adhere to these rules. Now, what I'd like to do next is let's create a hypothetical fat loss plan. If New Year's is coming and anyone wants to lose some weight, now we've got our structure, right? Now, I warn you, there's going to be some numbers involved, so everyone just take a second. Get ready with me. Okay, so if we're going to make this fat loss plan together, the first thing we need to do is calculate your maintenance calories. We're defining this. Maintenance calories is the number of calories you need to eat to stay the same body weight, right? Now, it's super simple. You take your body weight, you multiply by 22, and then you multiply it by an activity multiplier. For the sake of this seminar, let's just always assume it's 1.4. You're rarely going to be, you're rarely going to make any mistakes from assuming too low. Now, so if we take that hypothetical guy who walked into the consultation, needs to drop a few kilos, let's assume he's 80 kilos, and there you can see the maths. His maintenance calories is going to be 2,464. Now that's just a number. It doesn't really help us, but bear with me. It'll all make sense later. That's how many calories he needs to eat to stay the same weight. Now assume this guy wants to lose 7 kilos because Dr. Charles told him off, said waist circumference is a problem. Well, 1 kilo of fat has 7,700 calories. We multiply that by 7, we get that. And now we can reverse engineer it backwards. What's the time frame? 12 weeks, 20 weeks, 30 weeks, doesn't matter. For the sake of this, let's assume it's 12 weeks. You take that total calorie number, you divide it by 12, right, the time frame, and divide that by 7, and that gives you your daily deficit, right? The number of calories you need to eat less to be in a deficit to hit that target. Everyone still with me? Perfect. From there, you take your maintenance and you minus that, the daily deficit, and that gives you your total daily intake that you need to eat every single day to hit your target on time. Now that we have this number, from there, we apply the 5 rules, right? So we know it's 1823 calories. Now let's apply the rules. Well, you gotta be adherent to the plan. So we've got to find 1,823 calories and find a way that you enjoy eating. Again, 2 days a day, two meals a day, intermittent fasting, 4 meals, take your pick. From there, we've got to make sure nutrient density is maximized, right? You want to be eating lots of fruits and veg, find a way to incorporate it into the diet. From there, macronutrients, we've got to make sure we're hitting our proteins, carbs, and fats. Make it balanced. Every single meal should have a little bit of everything. And just drink enough water. There we have it. That's how to make a fat loss plan made easy. Any questions? Well, then I open the floor to Dr. Charles.
I actually could have listened to you and Mark talk all day. I'm really, really enjoying it. I think it's so useful, so interesting. And I feel like the three of us were all sort of driving, on the same motorway, the same highway, trying to get people to the same place. We're just using different cars, in different styles. But I absolutely love everything you said, and I'm going to borrow loads of it. So sorry about that. I'm going to steal your stuff and pretend it's mine. So I'm a GP. That means I do everything and anything. So cradle to grave stuff. Some of you know me from work, and some of you know me personally. So you probably know that already. But a particular special interest of mine is everything to do with men's health. Which covers physical stuff, covers mental stuff, covers sexual health, covers cancer, covers everything. And so seeing as it's Movember, I just thought of some of the most popular common topics that people ask and want to talk about, and I thought I'd explain a bit more about that. So this is the rough outline of what we're going to go through. If there's any questions along the way, I welcome interruptions, and we'll talk a bit more about it. So the bluff, the bottom line up front. And the main thing I want to say is men's mental health is, about men's health in general, is actually really easy. It's one of the easier parts of medicine. So there's parts of my job that are much harder, but it's the one that people don't want to talk about, which is ironic. It's the most satisfying, easiest to practice, with the best sort of success rates, and yet we don't do enough of it. So I encourage people to educate themselves about it, to investigate about it, to talk to me about it. I like to make people feel comfortable in the consultation, whether they're talking about an ear infection, or their nuts, or their mental health, or their marital strain, whatever it is. But my point is that guys just need to talk more about it. Girls are ahead of this on this side. They really are more happy talking about things that are specific to women than we are talking about things that are specific to men. So the bottom line is, whatever your men's health issue is, it's actually pretty straightforward to talk to a doctor about it and make it better. That's the key word, just better, not perfect, not cured. Just improve things, make things better. That's the bottom line. All right, so the next thing which comes up and that's super popular and interesting to talk about is testosterone. There's podcasts about it, there's YouTube videos about it, there's people that specialize in just this hormone. And I guess maybe one of the things I want to say is it's not the only thing to talk about, right? So especially in the gym and fitness community, people are obsessed with testosterone. And that's good, it's interesting to talk about, but there's more than just testosterone. So first of all, what is it? It's a male gonadotropin. Okay, so it's normal, it's healthy. We all produce it, just like females produce more of the female gonadal hormones, estrogen and progesterone. We produce a lot more testosterone. It helps to virilize us. Okay, so we look more like men after we've had testosterone levels go up. Hence, a prepubertal boy starts gaining muscle mass, gets hair, and looks more adult. And so obviously we benefit from it. It's good for us. And it does several things. Testosterone's also got emotional effects on people. Okay, so you might be wondering about, or not wondering, or have heard of the term libido, how much you have an interest and an appetite for sex. So most of us wake up in the morning, and it's just as natural to wake up in the morning with an energy for the day and an appetite for food as it is for an interest in sex, right? Or whether it's sex or masturbation or some sort of, sexual satisfaction, that is testosterone. And it's one of those things that people don't want to talk about, and yet it's completely natural. And it's one of the first questions I ask people to find out if they don't have enough testosterone, is I say, do you wake up with an erection? Some people don't, but if they do, that's already a good sign. If they don't wake up with an erection, I say, how is your interest in sex? So are you still interested in your partner, male or female, or pornography or masturbation? And when they don't have an interest in sex, they don't have a libido, I immediately start thinking that they've got low androgens, or at least specifically low testosterone. So that's one of the things it does, but there's plenty more that it does, but I'll keep it brief. And how much do I need, right? So this is really cool as well, which is if you see enough testosterone results, and we test most people now that they come in for a general checkup, we test it, it really varies. What's so interesting about testosterone, unlike, say, things like Dr. Adrian Chong is interested in, your potassium, right? It's very narrow. It's got to be between 3 and 5, and anything below or above is a problem. Testosterone can vary from like about 200 to about 900, and everything in between is normal, or at least can be normal for you. So I encourage people to find out what your normal is. So if you are feeling normal, as some of you might be today, and you have normal energy, normal appetite, normal recovery, normal sexual interest, and your testosterone is 300, that's normal for you. And the guy next to you who might be bigger than you or smaller than you, who might be older than you or younger than you, his might be 900. The point is, you know what your baseline is. And then what's super interesting is what happens over time. Because if the guy was previously normal at 900, now he's seeing me at 300, and we have that data from just 2 or 3 years ago, that's a problem. Whereas if you found my testosterone was 300 last year and it's 300 this year, that's okay, it's the same. So really what you're looking for with testosterone is, does any one individual have enough for them to meet what's called a threshold effect? So it's not the case that you need more and more is better. It's the case that you need a certain amount to virilize you, to have the effect. And then beyond that, you get diminishing returns. And we can talk more about how some people really push the limit there, of course, especially in the space of health and fitness and muscle and bodybuilding. But for most of us, it's something called a threshold effect. So it's not that more is better. It's just reach the amount that you need for you and check that it's not dropping over time. So with women, again, everybody's familiar with the term menopause. So they will hit pretty much a cliff in their 50s, and levels really drop compared to when they're menstruating in their 20s, 30s, and 40s. Whereas men, we have a nice steady slope. So it's normal to have a lower level when you're older, of course. But it's not normal to have a precipitous drop and for it to have gone to a quarter of what it used to be. Let's say if you're 60 years old and your level is a quarter of what it was when you're in your 20s, I would consider that a problem.
Charles?
Yeah, please.
Is there an optimal time to test your testosterone?
Absolutely. So,
When is that?
yeah, basically, ideally in the morning. It will spike like a lot of hormones do in the morning with a good night's sleep. And the other reason to test things in the morning, and there's some controversy about even like cholesterol, whether you should test it in the morning or in the afternoon, and people have changed the guidelines. I just like this rule of I want to compare apples with apples. So I want to say to someone, come in the morning when you're fasting for almost all bloods, because I can't compare you mid-afternoon, post-snack, hungover, not hungover. All of those are variables which in themselves might affect your electrolyte levels, your cholesterol levels, and your testosterone. So if I say to someone, if you've had a shit night's sleep, or if you're hungover, or if you've just been on a crazy weekend of really hard exercise, maybe now's not the time. We just want to know what normal you is like. And I personally have tested my testosterone in 2 different circumstances. And once was after a holiday in Thailand where I did no exercise. I ate well, I slept well, but no exercise. So I was well rested and well slept. And it was almost twice what it was at another time when I was super tired, super overfed, and I'd been out for a few nights. So if you want to just drop your testosterone naturally, get smashed, go out, work out really hard. And that's Yeah, and you're done. You're good, like in your tank, right? Now, of course, there's a balance because you don't want to, live at either end of the extreme. But it's very sensitive to the time and place. And sometimes if you find a low testosterone, you wouldn't say, oh, that's it. You are now hypogonadal. You say, we need to double check this because maybe it was just one bad night. So I encourage people, don't check it at other times of day and someone says it's fine. Just check it at the same time because when you next check it, it might be 2032. And all you'll know is, yeah, I always check it in the morning. And that's already a consistency, so apples to apples, yeah. All right, so if you are found to be a bit low, it's really cool. Actually, it's a sort of like a nice diagnosis in some ways. Doctors have some diagnoses that we hate giving and others that we don't mind giving, right? So if you found out to be hypothyroid, if you're low in thyroxine, we're kind of happy about that, right, between us, because we know that giving you this pill is going to give you some energy, you're going to lose some weight, you're just generally going to feel healthier and happier. And finding out that you've got a bit of low testosterone, or low for you, or dropping for you, and replacing it, right? That's what TRT stands for, testosterone replacement therapy. Just bringing you back to normal is a really, really satisfying treatment for both the doctor and the patient. And it's super safe to do, it's not complicated, and it's just a case of like adding salt to your food. You just add some and taste, add some and taste. All right, so we can measure your testosterone as many times as we need to, depending on what type you're having. And again, we could do a crash course on the types of testosterone, but roughly speaking, you've got topical things like gels. There are oral versions, but they're not great. And there are injectables. And the injectables come in ones that you take every day, a couple times a week, once a month, once every 12 weeks. So there's a big range of how you can replace the testosterone, but it will be tailored to suit you and depending on what you like to do and how much you need as well. But yeah, more is not always better. Sometimes less is more. Just a few anecdotes come up in my head. There's a patient of mine who's going to a World Triathlete Finals, and my testosterone is higher than his. I mean, it's literally not that impressive, and that's the whole point. He doesn't need that much. His threshold requirement for testosterone is probably quite low. He's got very sensitive receptors, and if I gave him more testosterone, it might actually make his performance worse. So he's probably going to either have an uncomfortably high libido, or it might irritate his liver, his cholesterol might go up, and he might actually not train as well. It might even impact on his cardiorespiratory fitness. So as much as some people for muscle gains and certain exercise want to take testosterone, if you offered testosterone in a way that nobody would detect to a marathon runner, or dare I say even some sort of, players like footballers, they'd say no thanks. It's not actually going to help them. So more isn't always better. It really depends on what the objective is. And then there's lots of cons being like any pill or any drug or any injection, there's always a downside. If anyone ever promises you a drug that has no side effect, it almost certainly has no effect, right? So that counts for water, for salt, let alone for chemotherapy, right? The trade-off is everything. Is it worth the trade? If you've got cancer, chemo is worth the trade. Otherwise, it's not. And the same for testosterone. There are some downsides. So I mentioned a few of them already, but your skin might break out, you lose a bit more hair, your prostate can swell, your mood can be a bit crabby. So there are some downsides. But if you're well short of the threshold needed for those downsides, and yet you've met your pre-existing threshold needed to feel like a normal androgenized male, then bingo, there's your level. And you might not have been able to do that on your own. So the way Shock and I talk about it sometimes is testosterone is just one of these things, but maybe some guys are out there driving with the handbrakes on. Lots of car analogies today, right? And the handbrake might be called your shitty boss and job. It might be your bad nutrition. It might be your terrible technique in the gym, or it might be your hormonal issue, of which testosterone is one. So knowing your level and checking it and monitoring it, there's real virtue in that. All right, prostate. It's another thing that lots of people ask about, and it's super common, and I'm interested in it at every level. And the big bad prostate, the big bad wolf, is not as bad as people think, all right? It's one of the most treatable cancers, if we're talking prostate cancer, compared to some of the other things that you can diagnose me with today, so lung or brain or pancreas. I'd rather prostate. Okay, that's not to say that some people don't have it badly, of course they do, but it's very, very, very treatable. So you should be leaning into the opportunity to find it. Right? So finding early prostate cancer is like a gift. It's an absolute privilege. If you found an early prostate or an early colon cancer, you are lucky as shit, because that stuff, just 20 years ago was only ever found at stage 3 or stage 4. And these days we're finding early cancers and then they're just treated. And that literally is life saved or years added to your life. So lean into the opportunity to learn a bit about your prostate. And the check, check, check thing, everybody thinks of the finger, right? And that's what puts people off. So that literally is a barrier to entry. I didn't want to ask it in here, but who thinks that going to get your prostate checked involves rolling over and have a doctor put their finger up your backside? Most people think that's what it involves. And that's not to say that some doctors won't. There might be good reasons for it. But I'll give you 3 really good ways to check your prostate. You can ask for this, right? You can walk in and go to see a doctor and you can say, I want to check my prostate. I'm not into this exam. It's a barrier for me, but this other guy mentioned these 3 things. So number 1 is a blood test. You're getting your testosterone checked anyway, because you've just had this talk. So you're going to ask for the PSA. And the PSA is the prostate-specific antigen. The more prostate you have, the more PSA you have. So if you just got a big prostate, doesn't mean you got cancer, but you still might want to track that number. If you've got a crabby little bit of prostate cancer amongst your prostate, that's also going to be high. So rising PSAs or a randomly high PSA is something we look into, and that's the first way to check. Second is a questionnaire. So just asking people, and there's a specific one, it's called the IPSS, and you can get a score between 0 and 15, and it puts you into low, medium, or high. And it's related to things like how easily can you empty your bladder, can you empty it to fullness, can you hold on to a full bladder, do you have a good stream, etc., etc. So far it's a blood test, it's a questionnaire, and the final one is scanning. And depending on how much money you have and what's available, you can get a painless ultrasound scan, which is just a jelly scan, which will have a look and tell you the size of it, right? If it's the size of a squash ball, that's okay. If it's the size of a grape, that's better. If it's the size of a lemon, that's no good. So no fingers up the butt. 3 really cool, useful, objective ways to walk out of the doctor going, I have a much, much lower risk of having prostate disease. And the other lovely thing about prostate cancer, which is almost uniquely true, I'm trying to think of another example, maybe colon, is it gives you ages to find out about it, right? So if I have an MRI scan of my brain today, because I've got a family history of brain cancers, or I read a story in the newspaper and I'm really worried about it, I could have a negative scan today, and that's great. If a tumor starts tomorrow in my brain, I could be dead in 6 months. So how much forward protection does that MRI buy me? Basically none. Whereas if you have a clean checkup of your prostate on those 3 things I said, so good questionnaire, good scan, good PSA, it buys you years. I didn't want to say decades, but it could be decades before the point of no return anyway, when it's gone too far. And that's similar for something called a colonoscopy, which is not necessarily specific to men's health, so I didn't bring it up today. But the point is, check, 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 do the easy things, right? As opposed to worrying about the things that are hard for you or embarrassing for you or stopping you from going in. And one more thing about the prostate, there's 2 really cool studies which have pretty convincingly shown that ejaculation is of benefit to the prostate. Right? And guys don't like to talk about this too much. Why not? It's crass, it's dirty. No, it's none of those things. So ejaculating is a normal male function in the same way that females menstruate. Right? It's unique to us as a gender, but it's completely normal, it's completely healthy, and you should be encouraged to do it. That doesn't mean everybody's got to go off and beat off after this, okay? Or if you're doing No Nut November, well done. If you raised money, that's great. But the point is comparing people who ejaculate often. I forget what the threshold was. It was more than 5 times a month versus less than 5 times a month, and men of a certain age and beyond, and they followed them. It was of benefit and of a protective factor to the prostate. So whether it's through intercourse or whether it's masturbation or whatever else you're having fun doing, ejaculation is good for your prostate.
How often would you recommend getting the prostate checked?
Yeah, good question. If you have a squeaky clean result, it kind of determines when the next one should be. So some people, again, who are younger than me, with less risk factors, their PSA is 0.3, their questionnaire is completely low, and this is part of a health check, and I'd say to them, you don't have to worry about it for 2 to 3 years. Like, you really don't. Whereas if someone's on the fence, we're like, yeah, we're going to actually see this medium-high level in 3 to 6 months, because that 3 to 6 month window is not so long that things have gone too far, but long enough to see the delta. And if that second test is any worse, well, then you're going down the pathway of looking into things.
Would you recommend doing the questionnaire on your own, or it's usually one where you do with a doctor and he asks you other questions?
That's actually a really good suggestion. It didn't occur to me that you could do it on your own, but you can. So you can look it up. It's called IPSS something. There's a number. But you could look it up on your own and see, oh shit, I actually score quite high. And that might just be the first thing that breaks the ice to the doctor. You say, look, I actually looked this up and I did it and I'm high. What do I do with this? And then he or she will tell you, of course, we do a blood test and maybe a physical exam at that point. Yeah. All right, your balls and your nuts. So what did Socrates said? He said, know thyself. Well, I say, know your nuts, right? So it's just another body part. I've probably seen more testicles than most working girls in one I have. I really do. I'm a specialist. And like, if you go to a dermatologist and you just show him your rash, like, He's just seen so many rashes. It takes him 2 seconds and he'll tell you if it's eczema or psoriasis, right? And if you've seen enough testicles, which most GPs have or most urologists have, it's not long. So you're lying on the bed, you're having your tummy felt, it's like, drop it down, quick look, yeah, we're good. Or immediately you go, that's not okay, or there's a thing, I want to check it out. So that's where we come from as a doctor. We don't see enough testicles, and we've got to break the ice, and we've got to buy you a drink first, and eventually, you let us check it out. It's another body part. Like, we don't take this long to, I basically just assault people with a head and neck exam when they come in with a cold. I don't ask permission. They're talking, I'm like, yeah, I get it. And I start invading their, orifices up here. But we don't do the same down there. And it really should be destigmatized like that. It's another body part. If you're comfortable with the guy in the room or girl and they're offering to do a testicle exam, bite their hand off, because you might not know what you're feeling. Having said that, you could get to know what you're feeling, and it's hard to demonstrate right now how to do one, but it's not complicated, all right? And you can look it up. There's some good ways of looking it up. The Cleveland Clinic has a particularly good self-help guide on how to look up self-examination for testicles. Girls, again, they're better than us. They get taught how to do breast exams. So girls get taught from teenage years, this is how you check, this is how often you do it. Nobody's really teaching guys unless it's part of a charity or a November talk or something like that. So I take the time to show everyone when I examine, this is how you do it. You do it yourself once a month in the shower. And if you find something, you just show us. That's it, really. And the cough test, yeah, that's not a thing. So checking for something called the cremasteric reflex, right? It's not that useful. But when we're having a look down there, we can tell if there's a little epididymal cyst, which is the most common thing, a normal natural swelling, like feeling a gland here. It's not a cancer. We can tell if there's a bit of fluid, something called a hydrocele, again, super common. We can tell if there's a varicocele, which is just like the varicose veins in your lower leg, except it's usually on the left side of your scrotum, right? And then we can tell if a testicle just feels not cool. And I've diagnosed a testicular cancer twice in the last 2 years, and both times it was immediately obvious to my hands, right? The guy came in saying something, I forget if it was urinary symptoms or something, but the minute I put hands on it, it wasn't right. So I wouldn't have been able to tell through a questionnaire. I didn't need a scan. It was immediately obvious, and the next call or referral was to a urologist, and they're both fine, minus one testicle. Yeah. Okay, dad bods and metabolic health. So I've got a photo that I keep as a motivation for me, which was me just after my second child. It was a family holiday, looking skinny, looking pale, looking weedy. I look like Mr. Burns from The Simpsons, right? And I'm in a pool, and my daughter, she's got a lovely brown skin, and it's sunny, and I just look awful. And I'm sitting there going, well, this is me. I'm that guy who's going to have this sort of catabolic process, this sarcopenia, and I'm going to be struggling with frailty for the rest of my life. And so I use that as a motivation, right? We all start somewhere, and I'm the weakest guy in every gym I go to, at least I was then, and with small levels of improvement. But the way I use that motivation is it's because I'm standing next to my daughter. And what I want to be for her when I'm older is something that's still strong, still independent, still useful. You want to be that savage granddad that's saying, keep up with me on the hike, not the guy who needs help, right, getting up and down from the bus. So I guess what I was talking about when I said dad bods, it's not just the cliche beer belly. It can also be the frail guy. And you can translate it not just to body shape, but how fit you are, how mentally stable you are, as Mark was talking about. Your ability to be resilient and tough and cool and calm when others aren't should be something that we all get better at as we get older. And I think a lot of guys aren't investing in the time and the mental housekeeping, let alone the physical housekeeping, to not be okay with having a frail, skinny, weedy, pasty body, or a dad bod, or stressful, personality that's easy to snap, or irritability. Like, these are not okay things. So the way I try to talk to patients is to motivate them that even if you don't care quite enough to do it for yourself, you almost certainly matter to someone else as a husband, dad, brother, son, or whatever it is. So do it for them. So my own personal motivation is this photo of me next to my daughter looking terrible, and I just keep that close to the phone and try to get as far away from that as possible. And yeah, as Shock keeps telling me, strength is health, and you'll know you're doing better when you're stronger. And strength in many, many ways, not just how much you can deadlift, but how far you can run and how long you can stand and all that sort of stuff. So what are we fighting? We mentioned stigma already about being a man and talking about our stuff as if we're not allowed to. So we should destigmatize male mental health, destigmatize sexual health. It's one of the things I talk about a lot. A lot of people come to me with about 3 or 4 problems, and then right at the end they go, yeah, and also I've got a discharge. So they're really embarrassed, or they don't want to talk about their STD. STD is not that different to a cough or a cold, okay? You got that from another human being, and the STD is the same thing. You were just doing something else. And last time I checked, it's not illegal to have sex. So if you ever think that you might have a part of your health that you're uncomfortable talking about, my question is why? And it's probably internal. Because if you get in a room with a good GP, I promise you the discomfort goes one way. Like they're okay with it. They're okay with you talking about, your smoking, your drug addiction, your infidelity, your mental health, your rage, your porn addiction, like whatever it is that you've got going on. For us, it's just another sign or symptom or data point. That's not to play it down, they're still relevant, but the stigma really has to be reduced, and that embarrassment really goes one way. Ignorance. So yes, a lot of times we don't know anything about it, and there's no excuse for that anymore, right? The world is now, free of information, and there's people like Shock and people like Mark who will educate and teach you to the nth degree. So I hate it when people pretend they don't know, and really what that means is they haven't tried to learn. Apathy. Apathy is even worse, like not caring. You should care for the points I said before, if it's not for yourself or the people that you love and love you. And randomness. Randomness, you guys will be really sensitive to that in this gym. If you see someone in the gym who's just gripping and ripping it, right? When I come and Shock designs a plan or a program, there's a specific muscle group taken to a specific level for a specific number of times a week, right? It's designed with purpose to it. There's an objective. And that's how men's health should be dealt with. What's the objective? Well, the objective today might just be to know that I'm well, I'm 45 years old, and I don't have any cancers. Got it. And next week it might be, the objective is I feel like everyone else is fitter than me and I'm losing my strength. Got it. We'll do that too. But be clear on what you're doing as opposed to randomly checking things, randomly taking vitamins, random health screens. Health screens are one of my bugbears. People don't know why they're doing them. They don't know what they're testing. And usually you get a whole bunch of information and you don't know what to action. So it's one of the things that we're having a little crusade on where I work on to really rationalize health screens. The why, the how, and what you get out of it, what you can actually do with it. So a good health screen, the objective that I tell people, if you're coming in for a checkup, and I say, why are you doing the checkup? People always say it's the same thing, or just a general checkup. I said, great. What we're going to do is we're going to find out the worst thing about you. That's how we're going to start. And it might be your hormonal health, it might be your sexual health, it might be your mental health, it might be your skin or your testicles, but we're going to find out the worst thing about you and start there. So, first things first, I won't go into all of these, but I just want to say that there's too many people who come to the doctor looking for a shortcut, looking for a pill in the bottle. Sometimes it's there, like you're hypothyroid and you're tired. But usually when someone comes in saying, I'm tired, it's sort of a euphemism, right, for I'm upset and I'm out of gas and I haven't met Mark yet and I haven't met Shock yet and my life's sort of falling apart. And what I mean by that is I've never met anyone who's having a tough time that has got all these 4 things in check, right? No one. And nobody has it, myself included, of course. But often I'll ask them about these 4 things, specifically diet, sleep, exercise, and their stress management or their social situation, and find out what's worse about it. So in my case, my sleep is the worst thing about it. I'd probably give it a 3 out of 10, right? My diet might be a 6. My exercise is up these days. It's a 7. Stress management might be another 5. So I'm going to start with my sleep. That's the worst thing about my lifestyle factors, where I can invest the most time and get the most reward. When I say time, it's logistical changes at home, or it's some compromise. You're going to lose something when you're paying for something. But the answer when someone comes in going, I'm tired, and I go, no problem. I've got an energy pill for you in a bottle. Here you go for $50. That's what they think will happen. And you remind them that actually the energy is not in the bottle. It's in the kitchen. It's in the bedroom. It's in the therapist's office. It's in the gym. And then, yeah, final word. You can just press right, I think, if it goes, yeah. Final word is pretty much the same as the first one, which is men's health is easy. From my perspective, it's not just easy. I don't mean that in a belittling way. It's really satisfying. It's really interesting. It's generally speaking really successful, really well spent money, right? So you can spend a lot of money in a lot of ways that don't really get you anything. But I think your dollar value when you're talking about your prostate, your testicles, your mental health, your physical health, your testosterone, etc., it's really money well spent, time well spent. But you have to start it. You have to be interested in it. You have that objective of trying to make something better, right? That crucial word. I use that all the time, especially when we're doing weight loss. Shock might have some guidelines. This is how many calories, but I'm just like, well, there isn't a race here. We don't have to get you to your destination next month or by Christmas or by whenever. I just want to know it's going in the right direction. And there's a very good phrase, which is when the patient's getting better, keep doing what you're doing. So don't change. So if you have someone who can objectively help assess you, a lot of people come in and they tell me, I say, so how's your diet? I'll say, my diet's very good. And what about your exercise? My exercise is great. And in my head, I'm thinking this, but I'm not saying it. I'm saying, well, we'll be the judge of that. Your diet's really good, except your liver function is terrible. You're on the edge of gout. And then you say your exercise is great, but you can't do a wall sit for 60 seconds and you're overweight. And again, I'm not judging here. I'm just observing things, right? So we make accurate observations with men's health. It's not judgments. And like I said, everyone, myself included, starts from somewhere in order to find that journey, that place of better. But it starts with you bringing it up. It starts with you being interested in it. Or if you're a +1, if you're a wife, if you're a daughter or a sister, nudging them in. There's so many guys that come in just because their wife made them, which I'm still super grateful for, right? And they ask so politely before the front door, is it okay if I join? I'm like, it's not okay. It's necessary that you join, right? Get your butt in here and sit next to your husband as we go through some stuff. And that's about it. All right. Thanks.